What are the top 2 or 3 current legislative issues related to health and wellness, and how do you see them impacting the concept of a healthy school?
In Colorado, we have quite a bit of legislation that's directly for health and wellness. So we have House Bill 1069 that mandates at least, on average, 30 minutes a day in elementary schools. We have House Bill 1254, which is our anti-bullying law. But what's more important, what I find throughout my work, are some of our health and wellness champions and the people who are doing the work on the ground. They aren't always aware of the legislation that can help support their work, and they don't always see themselves as part of the foundation of the new education system of our schools, some of the education reform, and some of those legislative bills that have passed. And so it's always nice to really show them, where do you fit in bills like Senate Bill 191, the Educator Effectiveness Bill. There are quality standards that our teachers and principals will be evaluated against, and health and wellness is a big component of that. You can have the strongest policy in the world, but if it's not implemented and you're not aware of it, then there's not a lot of accountability to it. And so I think it's really trying to increase that awareness and using it as a power lever and almost as, foundational. So we know that we have this legislation to back us up. So for fighting that vending machine war, for fighting the beverage war, we do have legislation that does eliminate sodas and even diet sodas from vending machines in our school. At the Legacy Foundation, one of the things that we call ourselves is an honest broker. We help inform policy up to that line, and then once it's passed, it's nice to be able to say to schools, we didn't help pass it, and now that it's here, how can we help you with the resources and tools and support necessary to be able to implement those bills?
How can Colorado Unified Improvement Plan help improve the accountability for school health outcomes?
When we look at accountability, it's another piece of really trying to make our health and wellness champions at the ground level see themselves in all the other systems and policies and the environment of the school. It's holding schools accountable for what do our students need and how are we reaching academic achievement. But it's looking at all of your student needs, having the data available, and then saying, based on this information, we've looked at the whole child. We know what our students need. We know what they don't have, what they don't have access to, what they may need access to that'll help academic achievement. So for example, if your major improvement strategy is I want to increase attendance, one of the action steps could be to serve breakfast. It's really trying to make health and wellness foundational to the school system. So too often health and wellness is something that's nice on the side when you have maybe a parent volunteer champion or you have a grant. If we know healthy students learn better, and we know that the research says that they will achieve and we will actually decrease achievement gaps when we have health and wellness included, how can we make ourselves accountable for it? Because if we're not accountable for it, then it's hard to make it a priority. It is nice at a state level and even at a federal level, like Dr. Bash was talking about this morning, we really are starting to get health and wellness on the map. We really are starting to have those conversations, and it's starting to be a consideration even in the bigger bills, like the Finance Bill and Educator Effectiveness and the Accountability Act. I think first of all, it's becoming aware. So knowing what your local wellness policies say, finding out what the legislation says right now, looking at what data does your school collect right now and what data is missing and what can we collect, how do we get to those resources. And once you do that, it's really finding out who's on the team, who do I need to talk to, who's on our district accountability committee, who's on our UIP team, and then joining those and being able to say, this is what I can offer.